Hello, everybody. It is great to have you here again. My name is Gary Fowler, and I am the host of GST Presents Silicon Valley AI and Tech. I'm a serial entrepreneur. I've done 17 companies, been involved in two unicorns. I was on the original management team of Click Software, which was sold to Salesforce for 1.35 billion, and also Eva.ai, an AI HR tech company. I am the CEO and president of GST Get You Done Venture Studios, a premier AI and quantum venture studio located in Silicon Valley, working in 24 countries around the world because we believe that intellectual capacity is evenly spread, but opportunities aren't, and we're here to make a change and a difference. So, with that, I'd like to talk about my incredible guest, Priyanka Mathur. She's got an enriching background, shall I say. She started off in India, did her medical training in Russia in St. Petersburg, and we're going to talk about that a bit. She's a visionary. She is the founder and CEO of Medipocket, and she talks about sick care models and data-driven healthcare and how we can make a dent in the universe for the future. And between you and me, living longer is really important. So with that, I'd like to bring Priyanka on board. Hi, Priyanka. How are you?
Hi, Gary. I'm good. How are you doing?
I'm doing great. So tell me a little bit about it. When you were in India, did you wake up one day and say, listen, I want to study in Russia? Was it like, and did you speak Russian before you went there or not?
It was really interesting that how I landed up in Russia. That was nowhere in my kind of in the map of my like I would be going. But I think it came as an opportunity. One thing I liked is always wanted to go to a cold place, and I think Russia was as cold as it can get.
Really? Wait a second. Yeah. I mean, did you like, because I know I lived in St. Petersburg too. Those winds off of Vasilisky Island, there was
Uh-huh.
like biting cold. I don't mean cold. I mean like 30 below zero kind of
Oh
cold,
yeah.
right?
Oh yeah. Oh yeah.
How was it coming from India? Did you ever wake up one morning and say, what was wrong with me?
So, a fun fact about that, Gary. So, the Rajasthan, the place I'm from in India, is actually hot place. It's considered one of the hot state in India. So it's like a desert. So from a
Mhm.
desert to a climate where it's like -30, you can imagine what a drastic, like literally upside down I was. But I enjoyed it definitely. I used to kind of every morning as like, what made you do that? But then after I would say a few months, I fell in love with that place. The cold, I think, stopped bothering me because of the beauty. As you lived in St. Petersburg, you will testify that it's a beautiful place. Even if 3 months of summer we get, it's beautiful.
It's beautiful. I'll never forget. I went north of St. Petersburg one time, and I had a friend of mine convince me to go jet skiing on the Gulf of Finland.
Oh,
Well, I didn't realize, one is it's not real clean, and two is it's not deep at all.
oh gosh.
We rented these jet skis, and you know how things are in Russia, right? There's a bar right by the jet ski place. Had a couple of drinks, really hot day. Went out there, and I remember going out in this thing, and I'm thinking to myself, this doesn't look very deep at all. And I think it was about up to my waist, maybe.
Oh wow.
Moving around, but it was like such an incredible experience. Here you have all these people on the beach, they're enjoying themselves, and I'm thinking to myself, how beautiful can a place be? It's like incredible. This was like in July timeframe,
Oh,
but I
beautiful.
also remember. Do you remember the White Nights, Billy Noach, when
Yeah.
so it's like, when does it get dark? It's like 2 hours of the night or 3 hours, and everybody's out partying. The bridges go up. You can't get back. It's an incredible place. No, it's really beautiful. And the Hermitage. I don't know if you had a chance to
Yeah,
go.
yeah. Oh my God, the piece of art, piece of art. Yeah, no, I definitely visited that and I enjoyed. So I think that's where, I mean, the Bailey Nochu, the White Knight you're saying. So my first experience with the White Knight. So I used to live with Babushka, which is we call the grandmother there. So I didn't live in the dorms. I lived as a paying guest because I wanted to learn Russian faster and I want to interact. So I lived with Babushka, the grandmother. And when it was my first experience of White Knight, I was questioning her, okay, when it's gonna get dark, when it's gonna get dark, and she's made me sit down. It's like, don't expect that for another 3 months. It's not getting dark anytime
Yeah,
soon.
yeah, yeah. No, I remember. And Priyanka, this is the only time it happened to me in Russia. I have a lot of crazy experience. I'm sure you have too. Good ones. I mean, I love my Russian friends, and my wife is Russian. But one of the things I'll never forget, people would say, "What do you think? Bears walk around the streets and walk down the streets in Russia?" And it was like a joke. I'll never forget. I was walking down Nevsky Prospect, and I'm walking along, and I'm not paying attention, looking at my phone, and I see the biggest dog I've ever seen in my life. I thought
Oh,
this thing must be a Belgian Mastiff, whatever, and it's a bear. It's like a
wow.
yearling with a muzzle on it, walking down the street with this guy, and I thought to myself, this is Russia.
Anything is possible there.
Anything is possible, right? The things that you think are shouldn't happen always happen. The things that are really easy may never happen, right?
It is such an interesting, I think, an interesting part of the world. I think every country has its own charms and everything of their own. But Russia carries a lot of different. It's a completely different world, I would say, in itself. And you would agree, though it has a European culture, but it has its own a taste to the things and all that. And another thing, I'm a vegetarian. So I'm a strict vegetarian from India, going to a place where people don't understand what vegetarian means. So my struggle began from the very first day I landed, and I was trying to look for a food. And I was like, vegetarian, they would be serving me seafood because in Russia, the seafood is closer to the vegetarian food. So they will be serving me seafood. I was like, no, I need vegetarian food. So I literally lived 6 years of my life on potatoes and vermicelli, which is kind of a noodles there. So 6 years I survived with that.
So wow, and so tell me, like, what was the most unusual experience you had when you're over there? And like, even today, you're thinking to yourself, this is like a little bit unique. What happened over there? Because everybody's got one of those stories, right?
So my was first week of my landing there. We had to go to shopping to do a grocery on my own. I mean, before that, I was accompanied by my seniors who knew how to interact. But then afterwards, I was like, okay, I can go by myself. Now, as you know, people like there to interact only in the native. Like you have to interact in Russian, even if they know English. I think they prefer just talk in Russian. If you are in Russia, talk in Russian. Kind of a rule applies there. So I understood that a lot of Russian words are kind of the tongue twister in English, like of quite a word, the English word, but they are like could be pronounced differently, and we will be able to communicate. So I went there. I need to purchase. I think I need to purchase a bread, and now I can point it, but it was a busy market and I couldn't point him. So I was telling from far, I was like, can I get brewed bread? I would meet all the kind of variations of a bread. I said brewed, briada, this and that. And that person is like, do you want a bread? And I was like, yeah, can I get it?
Uh-huh. And you got your bread.
I got my bread, but that happened with few stores that I went for the shopping. But I think that is an experience that I would remember. That I assume that Russians would understand any variation of an English word, and I used all the variations and all that. But finally, they'll be like, "You can point, and we'll give you." I was like, "Okay, okay." So it was interesting. It was a struggle in the starting. I would definitely say it wasn't an easy transaction for me, um, being a woman, and obviously coming from a country like India, it wasn't very easy, but I liked it. There were people who helped me during, the locals that were very helpful, that helped me to adjust and all that. But it was challenging. The first 6 months to 8 months were challenging there.
Now, how was the university there compared to India? Do you know, like, was it more rigorous, less rigorous? What was it like?
Less vigorous, but at the same time, I think it was less rigorous because in India, I think because of the volume, it's all too much competition, and that's why it's very vigorous. Whereas there was healthy. It was healthy. There was a very balance about the study part, and then the life around it, and then also the practical. So I really like the balance there. Also, my education there was in English. I know some people think like if you go to Russia,
Really, that's interesting.
be Russian, but they all, especially the main, the Leningradsky University, if you know, Mechnikova, they offer you the choice that, okay, option that either you can do in Russian or you can do in English. Definitely, you still need to know the language. You have your Ruski language training there, but medical education was all in English. So that was something I think when we people from outside don't know or don't assume that it could be an option.
Now, how hard was it to become a doctor in the U.S. after you went to school in Russia?
I would say it wasn't very hard because I went to India after Russia. I went to India. I worked there for 2 years before I came to US, and I think US education standard and India standard are quite same as far So I was quite exposed to that kind of standard, but at the same time to understand the infrastructure and other things, what took me a little time, not too much. Again, in India, I studied in a British school since my childhood to till my high school. I was in a British school, so again, I was more into the European kind of a culture. So it wasn't a culture shock for me, but it took me a quite a little time to understand, okay, how the things flow and then infrastructure wise.
Interesting. Wow, that's incredible. And so you went to school there. Did you travel around Russia when you were there, or did you just stay in St. Petersburg?
I did a very little. I went to Moscow. I traveled a little bit Europe. In Russia, I think I only Moscow. I went to Ukraine, actually, to the neighboring country. So not very much. I wanted to go Siberia, but I was warned not to do it. But that was the thing I think I missed, and I want to go back.
Really? Why were you warned not to do it?
I don't know. I mean, one of the thing I think they thought that being a foreigner and being, a foreign female, at that time I was there like in 2001, as you can understand that
Mhm.
now the things are more relaxed, but back then, it wasn't. So I was like told like, maybe not right now. Maybe you can get accompanied by a male friend or something, but just don't try to be a tourist by yourself.
Because I would go to Omsk on the weekends. I would go to Novosibirsk, Saratov, out to Vladivostok, Irkutsk. I would travel around a lot. I
Oh
mean, there
wow.
were some unique situations because there weren't a lot of Americans out in some of those cities, especially Greek Americans. There just weren't a lot out there, but people were really nice to me. To be honest with you, I would travel around a lot. Nizhny Novgorod, I mean Tver, which is close to St. Pete, all over the place. People were really nice actually, and really kind, and they would invite you in their house. And I actually had the other experience I had is that I spoke English with them, and they really liked it. So because they got a chance to practice their English, and so they would like use me as like the guinea pig to practice the English, and this is great. And
Oh,
I went and if I spoke Russian with them, and then I would transition over to English, it was like that would brighten their day because they would get their English practice from a native speaker. So I liked it actually. So Priyanka, tell me a little bit about what you're doing at Metapocket, and you're an AI and healthcare enthusiast. Tell us a little bit about how you're transforming a healthcare, from the sick care model to the data driven model. Which, by the way, I was just at the hospital. I had tests done at Stanford. I had a pancreatitis, and I saw how the system is a little screwed up because if you don't have somebody that's an advocate and you're dealing with multiple departments, you get lost in the shuffle really quickly, actually.
well, definitely. And that is the thing because having luckily the exposure of the three healthcare systems of Russia, India, and United States, um, unfortunately have to say that the system is broken in one way or the other. I would say fundamental foundation of it, which is primary care, as we understand. India has a struggle to access to the care. Russia has its own struggle, and US being very expensive. So our healthcare system, on a fundamental basis or a foundation basis, needs to be redesigned because when it was created centuries back, at that time we were still learning the diseases. We were literally discovering the medicine at that time. So with the experience, as your experience, when you went into the system, you were overwhelmed, you were lost because system is fragmented. Our system in United States is fragmented. um, Again,
Fragmented and crazy expensive, Priyanka. I mean,
I was about to say that.
I have insurance in Florida, Although
Uh-huh.
I have because I wanted to do the CPO, which means you get really good rates in Florida through
Uh-huh.
Aetna. And then, but if you go to some other place, you get emergency coverage, right? But these insurance companies, I remember speaking to a doctor friend recently here in Florida, and he said it's just a game. It's unbelievable. But the problem is, it's a really expensive game because when you're talking, you know, 5 days in a hospital or $300,000 or $400,000, it's not a game anymore, right? Some people, I mean, from my standpoint, I was lucky because of a lot of contacts and we got it resolved. But I can't imagine some poor person going in there that is has a regular job and it doesn't know how to deal with the system and they get lost and they get the rest of their life they're trying to pay off a 4 day visit to the hospital, right? It's crazy.
And the numbers, I mean, the statistic shows more crazy thing is that we are number one in the expenditure in the world in healthcare, but we literally stand on 33rd position in the quality we provide. So we are making our patient pay, but we are not getting them better. We're making them sick and say, because that's how the system gets paid. If you get well, then you won't come back to the system. And
Yeah,
that's
no, I agree. It's
money.
crazy. So how do we go? Who's number one, by the way? Who's the
Uh,
best? What's the best system? Is it Sweden or is it Norway or Israel? Where is it the
So
best
I
healthcare?
I particularly don't know which country, but Europe still, if we're comparing like the countries like US, Canada, and India, and Russia is close to India, I would say Europe has a better one. Switzerland, because again, because of the very small size of population, their quality of the care is definitely very good. But then the advantage with them is like they're literally handful, so you can provide a good quality when it's just like a small group of a small population. But if you're considering large countries like US and India, definitely they have their own struggle because the volume, we have a big, first of all, the area is very big, then the volume, the population is very big. But but definitely I think we need to redefine in a way where we can make it like pay for quality kind of. It's not when you get
I
sick you
agree.
just.
How do we do that? I mean, you talk about data driven. That's the ultimate situation. How do you go down through and hold the doctors accountable in the system? Because it's not today, right? For the most part.
No, it's not. And I think it's all about from the very basic. If we can make it a transparent, we really and one thing, as you would agree, your experience in AI, and you will help attest that we can use the technology to augment the system, to augment doctors. We have a lot of information of a patient. In from the past, we have these from the insurance companies, we have from these from a very social media platform, so data is there. We literally know what a person is thinking now and what you're going to do tomorrow, or it would be your next step. I mean, being on the electronic devices, they are collecting a lot of your movements and your data. We can use that data not just to commercialize. I think we can use that data to benefit in the healthcare. And again, when I mean data driven, is like when we know about patients health history, when we know about his social habits, we can use that and we can curate a health I would say a care system or a care program for that person. Let's say there's a healthy person who is in his 35 and he's very healthy, he's socially active, and he's physically very active, go to the gym at least 2 or 3 times a day, very, the type of the work he does is also very active. His lifestyle, based on the data that you have collected from the variables, feels like that he doesn't eat, I mean, he eats healthy, he doesn't eat very kind of like junk, and the drinking habit and all that. Now, based on that, you can always curate a care structure for him, that right now what you are doing is very good with your health. But then comes with the history of his family, because your karma could be good, but if your family's karma wasn't good, it comes and bites you in a way in the healthcare. So let's say if your family history has hypertension, cancer, conditions like that, then what you can do is you can warn this healthy individuals that are trying to do everything right, so that he can either minimize or avoid those things. You can give a kind of a, like, more insight into the health. Hey, this is based on this of yours, you have to be careful for this, or you can take these measures to like either prolong, let me to say delay, or literally kind of minimize and avoid these things. On the other hand, let's say we have a person who's completely don't care about his health. He's like a person like who would likes to just sit and have a Netflix or have a very sedentary lifestyle, and is not very much keen about eating healthy, doesn't have the energy, doesn't have the resources to put into things like that. In that case, we can create a care system around that person, motivating that person in a way where it doesn't feel like, okay, you need to go and see doctor every other day, but motivating through the technology, through the lifestyle of a person. Okay.
Well, I mean, here's Priyanka. What about this? And I just wrote a paper in Forbes, but if we tokenize the healthcare system, right? And we went down through, and so these desirable behaviors, they actually would get tokens. And we had it set up, maybe the Blue Shield or the Aetna token to go down through and to use it. So if a doctor gives you great care, here's the tokens that you're able to give that doctor. If you don't get the kind of care that you think you deserve, here's a range, and here's the deal. And we start to really drive those behaviors in an entirely different way. And you're also developing, you talk about loyalty. you know Part of the other problem is, Priyanka, how in the world do you find those doctors? So let's say you need a cardiologist, a specific kind of cardiologist, and you're trying to find them. It's impossible. It's not so easy. You go on the internet, you got to, like, okay, are they in Wisconsin, or are they in Los Angeles or Stanford or Mayo Clinic? It's not easy. So finding the right kind of resources, part of the other thing. The one thing that I saw myself with my father. My father had a stroke, and they said he wasn't going to live for a very long period of time, maybe a week, maybe 2 weeks. Well, I came in, I took him got him into a nursing home till I got his house fixed up, weeks. And then I took him home, and they said he would never walk and talk again. He walked and talked and bitched. He started complaining. And so I knew he was getting better. And he started to walk outside, and he lasted another 3 years, and 3 more years, quality years. And I understood then. And again, one of the nurse practitioners that came to the house said, the reason that your father's the way he is because he is an advocate like you. So what about, using with the healthcare system, we have these data driven models. If we take not smart but intelligent assistants, like having your grandmother in India that loves you and cares about you, that now curates this data for you and helps you understand what to do, right? Because part of the problem is, I mean, think about it. In your own personal cloud, Priyanka, you've got 300,000 items as a doctor. The entire web in 1996 was 257,000 websites. You, Priyanka, have more in your personal cloud than the entire web. That number is following the same trajectory. It doubles every year. In 5 years with IoT, you're going to have 10 million. Think about it. How many times to the audience out there in the last 2 weeks did somebody said, I've sent you a message? You said, well, where did you send it? I sent it to your Yahoo. Oh, I don't check that all the time. Can you resend it to my Gmail? So we're in a state of infobesity. And part of the challenge, what I saw recently, what I've seen at these hospitals is that they just don't have, you can't really control the system. One doctor, one specialist doesn't understand, doesn't talk to the other one. It's crazy, right? And so having the data driven capabilities to be able to help us with an intelligent assistant, just in my opinion, would help change everything, because it's going to get so much worse. Because and yet at the same time it could be so much better, because now we have the data. Now we can do something with it. If you find somebody that watches, well, I like Netflix, by the way, on occasion at nighttime, and Amazon Prime. So, but you're watching, creating a customized solution for that individual, a customized care plan with an advocate. And Priyanka, I think those advocates are universal. It's not just about healthcare. We don't understand it about finance, car, you know what I mean? Having like your own personal guardian angel that can watch over you, that has empathy, and is caring, right? Compassionate. What do you think about that?
I really like your points, and especially Gary, the one that you said that there is always a difficulty accessing the right care or finding a right specialist. This is actually a struggle because most of the time, if you don't have a reference, what you do is you go on Google and you try to find the right specialist for you based on the reviews, which could be, we know all online reviews, how good or how bad they could be, or how real or not real they could be. So actually we are addressing, and actually that is under our development stage. So what we're doing right now developing is Dr. AI. What this Dr. AI would be doing is this is your intelligent assistance that you were just mentioning. It will help you. It will take your preliminary questions, like what you'd go on the Google and try to look for. It will take your symptoms for what if you're looking for a doctor, for what you're looking. So it helps the patient to come into a right mindset and a little bit less emotional, because when it's about your condition, health condition, I think it's more emotions than anything else that plays the factor, and sometimes it aggravate or it kind of
Because it's fear, right? There's a lot of fear because you don't. It's a you don't know,
you don't
and
know.
some of those doctors don't know either. It's interesting, Priyanka. When I don't know, I'm sure you've seen it many times. But with my father, I was in the hospital, and I happen to have a doctor friend from Stanford. So I was in the hospital with a kidney specialist in Pennsylvania, and he was telling me some stuff that wasn't true. And so I just happened to call my friend as a doctor and said, "Is this true?" He said, "No." And my friend in California told me, and I said, "Guy, listen, I want to tell you a little story. I've been around the block a few times. Listen, here's what I want to have done with my dad. I just, I want to make sure we're on the same page because I know the deal." And he did. My dad lived.
And I would say one thing is access to the second opinions or references, because especially in the conditions like this, which is like, the cancer or conditions like those ones, I think you should never rely, as we shop around for everything. I'm not calling it to the shop around for the cost, but shop around for the quality and the right advice. Again, for
But
most
how
of
do you know, Priyanka? How do you know which doctor? Because you've got vast, wide experience. Not everybody does. How do you know? Who's the best, right? How do you say in this particular type of cancer, melanoma, who's the best? Somebody may be a great surgeon, but they don't understand this type of melanoma, all right, or this type of cancer. How do you find it? Can you help? With when you're looking at it with Metapocket, can you help do those kind of things?
that is what at the Dr. AI, what we are going to do, we are going to map the symptoms to the right specialist. And
Hmm.
it could be cross border. Let's say a patient sitting in India or Russia goes to Medipocket app and uses Dr. AI, put his symptoms, what they are experiencing, their condition. The system, the algorithms are going to match them to the right specialist. For example, in this particular case, melanoma. So we would be finding a specialist that has the experience, mean to say, if they have issued a paper, they have done a surgery, because things like that are always online, right? So we will be matching them. We will have a data set of those specialists around, especially for US right now we are working. So we'll have a data set of those specialists, and Dr. AI would map based on your symptoms, and there will be what you call is like, the tag words, and will map you to the right specialist. And then it will give you the option. Okay, for example, Dr. David has done, this many surgeries on melanoma, or have treated melanoma patient past 15 years. So it will not be saying just that he is an oncologist in general, because your condition is specific in oncology, what section of it. The same with the colon cancer, not a general oncologist, but okay, in the case of colon cancer, again, for example, Dr. James has done this many patients, and he's certified at Los Angeles, at UCLA practicing. So we will give patient more information so they can make a right choice. Now you can only help them providing the right information through technology, and then they can make their decision based, and the decisions are generally based on two things which I have experienced in the patient. Once they have found the few options based, okay, these are the three right specialists, either it will be based on their distance to it, how close is it, like by state or by country, and then obviously comes to the cost at some times. So it's like based on the distance and the cost, then they can make their choice out of the three.
Yeah, could you set it up so say somebody doesn't want to spend 300,000 in the U.S., but if they go to India, it's $50,000, right?
For open heart surgery, medical tourism is very big. So they can always be in the right, so it will be in the direction of a US specialist they're working with the help of their Indian associates, right? So it's not that the patient are feeling like I'm getting cut off from my US doctor or my primary care doctor, and then I'm completely going to a new person handling my disease just because of the cost. We still want to keep that kind of a confidence and kind of that no, the US doctor still will be directing all the procedure, but the cost will
Well,
be in the
Priyanka,
Indian.
the thing is, a lot of the U.S. doctors are Indian doctors, right?
See, we solved the purpose there.
Exactly. What's the difference?
I know, and that's the thing. The cross-border consultation we are creating, I
Mm.
think And one thing that it justifies is the quality, that we will get the right quality, even if at a low cost, but the quality would be there, especially the countries for medical tourism like India.
No, I
So
love what you're doing. It's really cool. It's really neat. And how far are you along with your project now?
So we do have the prescription vertical already live, which help gives the transparency and help. So we are partnered with 75,000 pharmacies in US, Hawaii, and Puerto Rico, where the patient can use the discount card. Right, the doctor AI is under development. We are actually onboarded 50 US specialists already. So hopefully by the end of this year, we would be able to provide people with this intelligent assistant, which can map them to the right specialist.
I had this. I talked to David N. Thistle. I wrote him, uh, and he's the head of Stanford Health, right? And I exactly told him about this. So just so you know, I had that conversation. I said, "What about this? How do you figure out why don't they talk to each other? How do I find the specialist?" I actually wrote him. So I love what you're doing. Listen, we're coming to the top of the hour. It's time for closing thoughts. And how do people reach you?
Mhm. I would like you to get connected over LinkedIn or our website, which is mymedipocket.com. Please feel free to reach us. LinkedIn is my Medipocket, and my LinkedIn is Dr. Priyanka Mathur, MD. I love to get connected people who are not in healthcare but would like to get the input and give, as you gave us a really good insight, and it validates what we are trying to work is something that people like your caliber and your experience are validated it in the past. Like this needs to be done. So I would really like to get connected people cross industry, and then maybe get the inputs or people. And we are also onboarding the team, so people who are in the AI, in the technology side, welcome to talk to me, and maybe we can find some synergies.
Sounds great. Well, I really appreciate it. Thanks so much. This is so timely. Like I said, I just went through this and have had these discussions. What you're doing is great, and I wish you a lot of success. To my viewers out there, thank you for attending one more edition as GST presents Silicon Valley AI and Tech. And I'm your host, Gary Fowler. Stay safe, stay happy, and keep smiling. Talk to you again next week. Thank you, Priyanka.
Thank you, Gary. Take care. Thank you.
Bye.
Bye.